right. Okay. So we are here with Dr. Megan Igo. We're talking about vaccinations and worming and the importance of doing those. I have some questions for Dr. Igo, but I also wanted her to just tell us a little bit about herself and what she does and how she became a vet.
So um like Amber said, I'm Megan Igo and I own Southwest Montana Vet Service here in Dillon, Montana. We are a large animal only veterinary clinic. We provide emergency and routine care, mostly to cows, horses, the occasional small ruminant, pig, alpaca. So yeah, so I came to Dillon several years ago. I did my undergraduate degree in animal science at Montana State, and then got my uh, went to vet school at Washington State University before coming back to Montana.
Got
So
it.
yeah.
Cool. Well, thank you for doing this for me. I know vaccination and worming is always a topic that everybody has questions about.
Yes.
So I'm going to ask you my first question. Why is it so important to vaccinate and deworm horses and mules regularly?
So we're trying to build that animal's immune system so that they're at a decreased risk of developing disease. And if they do develop the disease, generally the severity is less if that animal's been vaccinated.
Got it. What are the biggest health risks if owners skip or delay these practices?
They're definitely going to be more at risk of developing those diseases. That really just kind of depends on that animal's lifestyle, what they're doing on a day-to-day basis. Um, and same thing with deworming, sometimes we can see some, weight loss, hair loss, itchiness, those kinds of things. Sometimes we just see some like subclinical disease with horses and mules that are not dewormed properly. So all important things to keep in mind.
Yeah, perfect. And we kind of talked about, some people have a fallacy that mules are different than horses, but they're absolutely not. Mules are the same vaccine schedule as horses are.
Yeah, so there's just less research in mules, donkeys, other equids. So we have to extrapolate what we know from the research we've done in horses, and we apply those to mules, donkeys, miniature horses, whatever. So generally, we do use a very similar vaccine protocol as we would with horses.
What are the core vaccines that every horse and mule should receive and why?
Yeah, so core vaccines are determined by the American equine practitioners. They kind of keep an eye on the trends and what's out there, and they decide that these are diseases that the benefit of doing the vaccine outweighs any of the risk, and that all horses would benefit from having the vaccine. And so those are diseases like tetanus, Eastern and Western encephalomyelitis, rabies, and West Nile virus. And we've decided that those are core diseases we want to try to protect against because either they're really common in an area, they are really contagious, they cause pretty significant disease, or they could be a public health risk, so a risk to the human population as well.
Yeah, got it. What are some optional or risk-based vaccines, and when should owners consider these?
Yeah, so there's a ton of different risk-based vaccines out there. And the ones that are important really depend on, where you're at in your geographical location, what you're doing with your horses or mules. Um, and so those are vaccines that, are not necessarily one we throw at every horse, but ones that particular groups of horses are going to be more susceptible to, and so we want to protect them. So those are things like strangles, botulism, equine herpes, those kinds of things.
Got it. So it looks like travel and exposure to other animals is the big key. Got,
Exactly.
got it.
Exactly.
Are there specific times of year when vaccines should be given?
Yeah, so again, you're going to hear me say this a lot. It really depends. Most of the time we give our vaccines in the spring, this time of year. A lot of the diseases that we see, like you mentioned, transportation, now more than ever, we're hauling horses all over the country, all over the world. And so, they're just going to be exposed to more things. And so we want to protect them. Summer tends to be our busiest time to do that. So we want to get that immunity on board before we're exposing those horses to that. And then the other thing to think about is a lot of these diseases are spread by vectors such as mosquitoes, other insects. And so before, we get into the season where those critters can be a problem, we want to make sure our horses are protected.
Yeah. So quick story. I shipped a horse to California probably about 7 years ago, and she was traveling with an influenza carrier, and she immediately was infected. Just that, that 12-hour trailer ride of that horse being in the same trailer, and it was, I mean, she almost died. It was horrible, horrible. Plus, California doesn't have influenza, so that was another
Right.
as well.
Yes.
What about when hauling? So how often should boosters be administered? And, for different vaccines, like, do you do like a 5-way in the spring and a 4-way in the fall, and the 4-way is considered a booster?
Yeah, again, depends on lifestyle. Most of the vaccines we give, once the animal is up to date. So usually the first time they see a vaccine, they get it. They get a booster, 4 to 6 weeks later. And then it's labeled to be given on a yearly basis. A lot of times in the fall, if we still have horses that are active, moving around, doing whatever events, trail riding, rodeo, whatever, we might add on some of those, more risk-based vaccines or boost them, things such as like, the different strains of equine herpes, influenza. So a lot of times, we're doing spring, higher risk horses, we'll probably boost in the fall. But yeah, most of those vaccines are labeled as a yearly vaccine.
Got it. So I breed my stallion, as you know, and I've been foaling out some mares here. And one of the biggest questions that the mare owners ask is, should we vaccinate the foal? And I couldn't you talk about a little bit about that and the importance of doing a pneumabort or a rhino series with the mare?
Yeah. So the Pneumabort, that's the vaccine that we give to pregnant mares, to help build up an immunity that's going to protect not only that mare but also her foal. Once that foal is born, he's going to get some antibodies in the milk that the mare produces that are going to protect him. For the first couple months of life. So again, it depends, so foals that the mare has not been fully vaccinated or we don't know are going to get more vaccines earlier in life than foals that are born to mares that are fully vaccinated. Um, so yeah, again, it just depends.
Right. Got it. Um, What types of internal and external parasites are we targeting when we're deworming our horses and mules?
Um, So there's a whole slew of different internal parasites that we're trying to target. And again, it depends what part of the world you're in. Here in Montana, and in a lot of the world, we're talking about things like strongyles, roundworms, whipworms. Sometimes we see tapeworms in horses. Bots is a big one that we worry about occasionally. So yeah, and then again, there's another a timing issue. In the spring, there's certain parasites that are more prevalent than, in the fall. And also we have to be a little targeted with how we're giving those based on the life cycle of those parasites. So I mentioned bots a little bit ago, and so that's a big one in the fall we tend to try to hit just because of how that parasite's life cycle is. They're more susceptible to whatever we're treating that horse with at that time.
Got it. So, we've talked about before that horses develop like an immunity almost to the or the I'm sorry, the parasites develop an immunity to the wormers. So it's probably a really good idea to check stool samples before worming, so we use the correct drugs, right?
Correct. Yeah, and there's a lot of different schools of thought out there as far as best practice for deworming protocols. In the past, we've heard anywhere from, we do it routinely, twice a year. I've heard of people doing, that deworming protocols every 6 weeks. Um, we're kind of trying to get a little bit more strategic with those things just because we are seeing some resistance to the dewormers we have available. And we want to minimize that so that we have those drugs as an option in the future. And so the way that looks for me is, a lot of times I will recommend doing a fecal evaluation. So we take a fecal sample, we process it, and we can actually see what kinds of parasites that horse has or doesn't have. And so that allows us to say, like, this horse doesn't have any parasites, there's no need to treat it. And if it does have parasites, we know what kind and what the best medication would be to clear that.
Yeah. So you talk about the best medication. Can you kind of elaborate on the different types of dewormers?
Yeah, so there's a couple big ones that we use in equine populations. So the one you'll see commonly in the spring is called fenbendazole. The trade names you'll see are, Panicure, Safeguard. And then we see a lot of ivermectins, and there's a lot of drugs that are very similar to it in the same class, so they work similarly.
Mhm.
So, and those are ones that we tend to use more like in the fall to get those bots and other things. And there's a ton of different trade names out there made by different companies. Um, and then sometimes we see some combination products also, especially with the ivermectins, where we've added in a drug called praziquantel, which is trying to clear tapeworms.
Got it. Got it. So, besides vaccines and deworming, what other management practices would you suggest to reduce disease and parasite load and whatnot? Like, is my horses drinking out of a well, or are they on a live stream, or
Sure. Yeah, so, good biosecurity practices are always important, especially if you are commingling with other outside horses, you're traveling, whatever. Being aware of sharing, water buckets, fence lines, and tack, those kinds of things. Like you mentioned earlier, throwing horses in the same trailer together that maybe have not been exposed previously are something to think about. So those are always important, biosecurity measures, keep things clean. And so we're not inadvertently spreading disease. um, and then, also just routine care, dental care, hoof care, are going to be really big ones. Thinking about the environment, is my horse standing out in a mud hole, where it's going to be more conducive to harboring, different parasites. If you have a stagnant pond on your place, you might have a bigger mosquito population there that could carry things such as West Nile. Um, yeah, so those are some of the big ones, and I would say a lot of that, is those are good conversations to have with your veterinarian, just depending on your specific set of circumstances.
right, right, yeah. How many variations? I keep hearing you say, well, depends, depends.
Yep.
So the best thing is to have that relationship with your vet and be able to ask those questions and
For sure.
Yeah, and your vet, I'm sure, is well educated in the area you're in. So,
Yes.
well, thank you, Megan. I so appreciate your time on this. We're going to post it on my school community, and if anybody has any questions, I'm sure they'll reach out.
Perfect. Thank you.
All right, thank you. Have a great day.
You too.
All right.